Do you have any final advice for nursing educators on how they can better prepare nursing students for the challenges ahead?
I think it's important for us to keep our enthusiasm high and remember why we're doing what we're doing. Sometimes it can feel like a thankless task, when we experience some discouragement, as teachers. But I think that we just need to remember that we're preparing that workforce of the future. And these are the individuals that are going to be taking care of us and our loved ones. And we want to be sure that we're doing the best job possible. And I have to say, I work with some very fine, very motivated nurse educators. And I think it's about taking a lot of pride in what we do and just staying up to date on the latest developments that are there. And there's a lot of opportunities available for us. So it's a sacred trust. We see it as that because we know that we're making a difference in the next generation of patients. And we often get care from our graduates. So we are very vested in making sure that they're well prepared.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals, enabling them to improve care delivery through integrated design and technology innovation. My name is Greg Malkery, and joining me is my co-host Keith Washington. Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, then you're in the right place. Let's explore together what's possible when we go beyond the blueprint. Today, we're excited to explore the future of nursing, where we're going to focus on the opportunities and challenges for training our next generation of student nurses. Our guest speaker today is Dr. Brenda Hage, professor and director at the School of Nursing at Florida Gulf Coast University. She has extensive experience in primary care and gerontology, and her research focus on the challenges in today's nursing workforce. Brenda, welcome to our webinar. Would you like to start by telling us a little bit about your background and your interest?
Sure. Well, thanks so much for having me. This is a great opportunity, and I appreciate having the chance to chat with you. So in terms of my background, again, as you mentioned, I'm a nurse practitioner. I'm prepared as a family NP, adult gero primary care NP. And I'm back in school again at this seasoned phase of my life as a psych mental health nurse practitioner. And I have been in higher education for going on 28 years. So have taught in a variety of programs, including undergraduate nursing, graduate nursing, ran a nurse practitioner program for a while, started a doctoral program, was a chief nurse administrator and assistant dean. And in my current role, I serve as the chief nursing administrator of Florida Gulf Coast University, where we've got several programs in undergraduate, an ABSN and BSN, a master's in nursing ed. And then we have our doctoral program for family nurse practitioners and psych NPs and for nurse anesthesiologists. So a lot going on, but I've been immersed in nursing education and also in my work in geriatrics and gerontology. That's informed my teaching and my administrative focus as well. And I've enjoyed my work with older adults in geriatric care management and in physical and rehabilitation medicine.
Wow. Thank you, Brenda. Now, if I'm not mistaken by looking at your bio, you don't have one doctor, you have two.
I guess I just didn't like watching reality TV. I earned my PhD in health-related sciences in gerontology from Virginia Commonwealth University. And then a few years later, we decided at the school I was at that we were opening a Doctor of Nursing practice program. That was still a pretty novel concept. And I saw a lot of schools trying to do almost like a PhD light preparation. But the intention of that degree was to prepare clinicians to function at the top of their license. And I really felt like I needed to practice what I preached. And so I chose to do a DNP program so that I would be really bringing the students what they needed to prepare them properly in that role. And I'm glad I did it. It really informed the program development and administration and teaching that I did.
Great. Thank you, Brenda. Keith, do you have any opening remarks for today?
Thanks, Greg, and welcome, Brenda. It's great to have you. So I think this is an exciting topic. I think we talked to a lot of leaders in hospitals and health systems, but thinking about the future of nursing from an educator's point of view, I think is really exciting. So I'm really looking forward to this.
Great. Thank you, Keith. Now, before we dive in our discussion, I want to express my gratitude to our valued sponsors, Storage Systems and Simplify Medical. So with that, why don't we start off? No gotcha questions here, Brenda. With many nurses nearing the age of 50 and burnout on the rise, how is this affecting the nursing workforce?
It's really interesting that you should raise that. It came up in a conversation that I had with some folks at my workplace recently. So I think we're losing a lot of the experience and the wisdom of nursing at this time. We've got a lot of up and coming folks that are, bring wonderful energy and have a lot to offer. But there's a lot that, those of us who've been in the field for some time have, and the collective wisdom that we've aggregated. And what I've seen personally just in the last couple of years within the state of Florida is that several schools within the state university system, and also the for-profits and not-for-profits and privates, have had a real turnover in senior nursing administration. So not only are we losing nurses and nurse educators, but as we age, people are retiring out, and we don't necessarily have a bunch of people jumping in to fill those roles. In senior nursing leadership, there's a real vacuum, I guess, and there's a need for fellowship programs that relate to executive leadership to do succession planning to help to make sure that we've got some smooth, even leadership and people who've got experience in the trenches, and then also engaging nurses to decide to enter in nursing education. And that's hard because you can make a lot more money in clinical practice, and it's not necessarily an attractive option for a lot of people. So I think those are some of the challenges that, we're facing today. And there's some solutions, that are coming forward too. But both from an administrative perspective and from an educator perspective, we're seeing the graying or silvering of the nursing workforce, and we're losing some of that wisdom. And again, the same thing in hospitals and in clinics and other places. Nurses are leaving the profession, and not necessarily because they're getting older. They're just choosing to do different things. And we saw that a lot with COVID. I think that was the impetus for so much. And I think some of that came from the moral distress and the burnout that people were experiencing, because it was just days and days and days of very intensive, distressing, clinical situations you were encountering, and not a lot of support for those nurses who are enduring, and other health professionals as well, the tremendous burden that disease and all that came with it, placed on our healthcare system.
In particular, when you look at increasing acuity level and the significant labor shortages, what kind of impact is it having on nursing practice as a whole? And then in particular, in more underserved areas?
I'm not sure I heard the last part of your question. I apologize. So nursing practice, like
having a nursing practice, and then in particular in more underserved areas.
I think there's always a need for nurses. That's the one great thing that people can count on in this profession. I think the skill mix of what we need is maybe changing a little bit. I think that if you're just in practice and you're not trying to, work in higher education at the same time, I think there's a lot of opportunities available for people. There are some differences in compensation depending on what part of the United States you live in, and whether you're working as a staff nurse, as an RN, or you're working as an advanced practice nurse. I think that's one of the big challenges that are facing hospital systems. Systems, in many cases, are paying millions of dollars every year in locums fees. And that's for people who come in and float in as a worker, but they're not your full-time employee. And it costs so much money. But to change that paradigm, you've got to find ways to attract and retain nurses, make it attractive for them to stay. And a lot of that relates to governance. They want to have a voice in what happens to them. They want, nurse-friendly and family-friendly work policies. They want to feel that there's a place for them to stay well and to develop their resilience. So I think those are the challenges and opportunities that employers are facing. At the advanced practice level, I think there's such a shortage now in medicine of physicians that the barriers that were faced when I initially became an NP back in the late 90s, where, you were sort of a zebra. I was one of the first NPs to get credentialed or privileges at my local hospital. And they kind of looked at me like I was from another planet. But now it's become very commonplace. And I think that there's less turfism because we all need to put our shoulders together to the work and work together to achieve what we need to for patient care. I think there's less pushback on some of those things for the most part, and a lot of opportunity.
How has systematic design influenced your approach to nursing education?
Can you tell me a little bit more what you mean about systematic design?
Yeah, maybe the whole idea of kind of an overall strategy and plan on how you're approaching nursing education today versus how things might have changed over the last decade. Is there a new approach?
There certainly is. Competency-based education has come to the forefront. It's interesting because medicine is kind of ahead of the curve in that regard. They're starting to look at, this artificial number of residency hours that people need to have or experiences, are those really what's required? And maybe we need to do a paradigm shift where we look at what does it take to develop competency in an area? So rather than clock hours or seat hours, do we need to look more at specific skills that individuals need to have in a certain level of proficiency at a particular time? And is that a better indicator that someone's getting what you need them to get in terms of their education? So I think that the emphasis on competency-based education has presented new opportunities and challenges. I keep saying that, but that's, the yin and the yang of it. And evidence-based practice. We're now doing things based on what does the evidence show is efficacious. And that's what we have to teach our students. So I think those are two major drivers that are very transformative in terms of what's happening in higher education, particularly in nursing nowadays.
From the nursing school's perspective, how are you using real-world scenarios and interdisciplinary teamwork as you try to prepare your student nurses for the real world, which could be in a variety of different healthcare roles?
I think there's some core principles that you can kind of count on. So the fact that, there's no I in team, healthcare is a team sport. We know that. So you have to find ways to help students to know how to work as a member of an interprofessional team. And just to give you an example, at our university, we had the first ever interprofessional education disaster drill. Over 600 people were involved, including many, many hundreds of students. And we practiced doing a mass casualty event where they had a helicopter fly in. We had the Florida National Guard involved. There was triage. There were different assessors, and students worked in interprofessional teams to deliver care under really terrible circumstances. We had bodies of victims that were out in a field, and it was supposed to simulate like what might happen if there was a plane crash or some type of natural disaster. And I think those kinds of things really help drive students. And that's a big, kind of showy example, but a very important one. But you can also do it in the classroom in terms of helping students to think out of the box and prodding them a little bit through questions about what would be different about this scenario if it involved another professional or another, group of patients. And so we begin to expand their thinking. And then through the use of laboratory and simulation opportunities, they get to practice what they're learning theoretically in application-based ways, and that gives them feedback. And now with virtual reality, there's a lot of opportunity there. So lots of safe ways for students to practice. I love our skills lab and our sim lab because it's a safe place to make mistakes. You make the wrong decision and you're running a code in the sim lab, nobody dies. But in real life, somebody is, practically for all purposes, typically they're not breathing, they don't have a pulse, they are dead unless something happens that you can do for them. So it helps the students to work through their anxiety, gives them a chance to practice in a safe real world environment. And then they're more conditioned and prepared to deal with real emergencies that occur. And they even learn how to talk to patients too. Learning how to therapeutically communicate with people is an art. And we don't spend enough time on it because everything we do is based on inputs of communication and data. And we have to learn how to interact with people effectively. So that's another big piece, the EQ of it, the interacting that we really want to teach them as well. So those are really important components.
Maybe also tap into some of the emerging technologies as it relates to interdisciplinary teams and collaboration. I believe that's more important now, or maybe more significant focus than maybe it's been in the past.
There's lots of innovative technology. We have something where I work called Dr. Hologram. So picture almost like a refrigerator-sized box, but it doesn't have the door on it. You can actually, let's say we have a really interesting case that's something you don't see very often. You can actually interview somebody and then cast a holographic image in smaller boxes that sit on a tabletop so students can actually learn and interact with this individual. So you're really leveraging technology to give you some really interesting things that you might not otherwise have an opportunity to see. So that's just one example. We use something called an anatomage, which is a virtual human kind of situation where it's picture like a rectangular table that sits off the ground, and you can literally cross-section a human body. And when you're teaching students about, how a joint looks or what a heart valve looks like, you can take them in that room and show them through anatomage, like this is what the physiology or the anatomy looks like. So it really helps students. And today's learners are very visual and they're very tactile. They're used to inputs from technology and outputs and haptic feedback. Like I bought a whole series of mannequins from a company that are wearable. So for example, you would put on a chest piece and you would simulate, for example, somebody inserting a chest tube in the person, and there's a buzz that you can get inside the wearable stuff that tells you when to moan, groan, like that kind of stuff, to give real feedback. Or let's say there's an arm that the students are starting an IV in that's attached to the suit you're wearing. And, you might like, ow, that hurts or whatever, when you get the right feedback from the haptics that makes it a more realistic experience for the student. And they're learning about the emotional response to pain, how what they do affects people, and it really creates a more realistic environment for them to learn. So I think the technologies are really helping us to leverage so many different things. So there's a lot of opportunity. They're very expensive. They need to be replaced, and there's always something new coming around. And the bigger problem is interoperability between systems, but those are common to any technology innovation have.
I'm just imagining that the younger nurses are more technology savvy coming in. Is that helping, or are they demanding the use of technology? Whereas maybe the older nurses are a little more skittish about learning some new skills or use cases.
It's interesting you should mention that, because in the course of my career, I've always noticed kind of a bimodal distribution of technology comfort with my students. On the one hand, I might have a mixed group of students where there's some that are more mature, older individuals, and then I have some very young students who don't have experience. Each brings different gifts to the table. The younger students are more facile with technology, like they grew up in kindergarten doing PowerPoints and all that kind of stuff. That's nothing to them. Whereas the older students struggle sometimes with learning those technologies first going back to school. But when they're in the classroom together, the younger students get the benefit of the wisdom and the nursing experience of the older students. And then the older students get the benefit of the technology piece. I think that there are generational differences in expectation, both in the workplace and in the classroom. There are some things that you have to do to keep students engaged that are different than when I was there. They don't want a sage on the stage. They want the guide on the side who's going to stimulate their critical thinking and engage them in creative learning activities, as opposed to somebody droning on in a lecture. So I think that's a good thing. And it challenges us as educators to up our game, learn new techniques, and keep things really interesting and exciting in the classroom.
Now, as an administrator, also an educator, how do you keep students engaged? How do you help them take charge of their learning and their career paths? Is it different now than it's been in the past as you're encouraging them to become a lifelong learner?
I think the lifelong learning concept's been around for some time, but I think students have very high expectations, and they should. They're consumers and they're buying an education. They're also, I see a little difference in values, and it's not necessarily good or bad. It's just different. So for example, if you ask someone the why of why did you go into nursing, people of different generations might say, well, I really want to help people. I want to make a difference. And those are all good things. And, big reasons for why people should go into a helping profession. And then I'm seeing more and more younger students who are very sanguine to the economic opportunities, and that's not bad. We should think about those things when we choose a profession. A little less of a glowy altruism and a little bit more realism. And I think it reflects the economic realities that they're living in. Higher debt, carry harder to start a career. So they tend to focus a little bit more on those tangibles. And we just need to meet them where they're at. It doesn't mean they don't care. It doesn't mean they don't want to make a difference. It just means that they have been acculturated to a different set of values. So I think part of the challenge of today's educator and employer is learning about the Gen Xers, the Gen Zers, the Gen, Yers, and what makes them tick. And then how do I engage with them in a meaningful way that meets their needs? So
awesome.
Yeah.
Last question. Then I'll hand the baton off to Keith. How do you envision nursing education evolving over the next several years so we can continue to better prepare nurses to hit the ground running upon graduation?
I think the more we can immerse them in the clinical environment, the better. So one thing, for example, I'm doing with a local partner that I have is something called a designated educational unit. It's not a new concept. It's been around for some time, but it's where you're immersing students in, for example, a hospital system. You have a unit that's designated for your students, and they work very closely with the nurses. And these are students who've gotten scholarship monies from this health system. So we're embedding them even further in that system, which hopefully will increase their retention and their engagement there. So I think strategies like that, where you have these academic practice partnerships, that's going to help, with the engagement and the retention of students. And we're going to have to do more and more of that, I think, to be creative. Also, with limited clinical placements, you got to be creative as well. So I don't know if that fully answered your question, but.
Great. No, that was good. Keith, do you have any thoughts and questions for Brenda?
A couple things you said I want to double click on. So the first is the soft skills in your curriculum. So tell us about a little more about that, say with more patient-centered care, more kind of the expectations from the patient. And then I guess the other side I wanted to explore with you in your curriculum is that talking about sort of leadership shortages and burnout with leadership. I guess, what are you, as an institution, what are you guys doing to kind of address that in your curriculum to train these nurses for the future to become leaders?
Sure. So the EQ stuff, I think that we start teaching students in some of their earliest classes when they're learning how to do a physical assessment or physical examination, how you elicit information from somebody, how you put them at ease, how you engage with them and develop a therapeutic relationship and trust. And then that gets developed even further, especially when they do their psychiatric mental health nursing and you're creating a therapeutic alliance. And, they learn over the course of their program, how to engage with others. And I think it also requires a certain degree of self-awareness of the students. So, we have them maybe doing peer evaluations of each other, how to give feedback, how to receive it. How does it feel when somebody gives you a critique? How might you like to be, or how might you do a better job in terms of critiquing others or giving them feedback. So you're sort of layering that in more complex ways throughout their program. So I think that's how we develop those skills. And then through, again, simulated experiences as well. I think the other part of that for students is developing resilience. And that is something we've seen them struggle with. So today I had a meeting with the lead psychologist in our counseling center. And we're doing an innovative program where we're looking at embedding a mental health counselor within nursing. And other schools perhaps may have done it in the past, but we've seen a big uptick in anxiety and depression among our students, and not just in nursing, but across the campus. But I'm particularly concerned within the School of Nursing, and I had an opportunity and funding available to embed a licensed mental health counselor and a postdoc who is a psychologist who just has to get some additional hours before they can sit for their licensure exam. And our students responded very positively to that. And we're continuing to work on resilience and wellness. And that's a big focus nationally with our accreditor, because that's how you prevent burnout and how you can retain people, is you've got to teach them how to nurture and care for themselves before they can care for others. As far as caring for leaders and growing leaders, I think there's a lot of great opportunities through leadership fellowships. So I've been fortunate in my career to have done 3 of them. I was a Duke Johnson & Johnson Fellow. I was a Leadership and Academic Nursing Fellow from the American Association of Colleges of Nursing. And then they have another experience through the Wharton School for Executive Leadership. So I think that our professional organizations should be offering, as our accreditor or our national association does, scaled and leveled opportunities for leadership growth where we can do some succession planning. So someone who has potential as a leader, you get them in a fellowship program if you can. Our school at FGCU, our university, has a great support program for faculty where they offer some leadership development opportunities through the provost's office and in other means. So there's lots out there within higher education. And in the workplace setting, let's say it's a hospital, getting on a risk management committee, getting on a shared governance committee are ways that nurses can begin to parlay their interests into leadership development and skills. And talking to your manager or your supervisor or your nurse administrator and saying, hey, this is a goal I have. How can we talk about how I can get there? And I think through mentorship and very intentional development planning, we can really help to invest in the next generation of leaders.
Oh, that's really impressive. So then I guess maybe back to some of the soft skills, and you'd mentioned sort of an increase in anxiety and sort of taking care of the mental health of your students. So how does that maybe translate into working on the multidisciplinary team and sort of maybe, I've heard sort of the Gen Z sort of described as a generation that's kind of grown up looking at screens, not necessarily learning from their peers. Are you finding that to be a challenge, or how does that work in your curriculum?
I think it's a couple different things. The students really need to be engaged. And so we can't just stand there and recite things to them. We have to engage them. So like the flipped classroom, where you give them an assignment and content the night before, and then they come in and they do a case study. So they're applying what they learned. It engages the learner more, gaming in the classroom. Those are strategies that we can do. I think in my area in Southwest Florida, we've had like 4 hurricanes, I think, over the last year. And they were very devastating for many people in the community. So our university did a wellness check-in where it was like, has this affected your housing, your transportation, your ability to do classes? Do you have a computer? Like, you have to look at, it's almost like social determinants of health, or it actually is,
Right.
because you can't expect things from people when you're not looking at them as a whole person. And I think that's one thing that Florida Gulf Coast University is really good at, is really being learner focused and trying to make sure that we're helping them. So they gave students some special dispensation in terms of being able to withdraw from a course if they were struggling, maybe having extended time for assignments. Because you can't ignore the reality of, some people lost a home, they lost their job, they lost a vehicle. We lost clinical sites for a couple of weeks because places were flooded. So we had to come up with a plan B and use some simulation and some other things until we could get back into the clinical site. So it's always being adaptive. Adaptation and flexibility, I think, are 2 keys for us in today's environment particularly. And nurses are pretty good with that.
Yeah, so that'll definitely drive teamwork, things like that. So I guess maybe getting into one of your specialties, you'd mentioned the geriatric care. And I guess when you have students, do you try to be intentional about encouraging them to go into a geriatric specialty, or how do you think about that to try to make sure that we've got enough nurses pursuing that specialty?
It is a passion of mine, and I really do try to speak positively. I've guest lectured in the gerontology course because I want the students to get excited about aging. And selfishly, as I age, I want to make sure that they're energetic, excited people who are providing that care. And I really want to challenge their paradigms of older adults. And Greg knows the story because we've spoken many times over the years, but I have a mother who just turned 89, and my mother just changed out the hard drive on her laptop 2 years ago and built every kid and grandkid in our family their own computer from parts. So we shouldn't make assumptions just because somebody has gray hair or they've got wrinkles that, they're just hopeless with technology. Many older people struggle with it, but somebody like my mom was the computer guru for her neighborhood. And so everybody would bring their laptop or computer over and she would fix it. I used to tease her and say, you should do like a computer granny, like a business on, she consulted in IT until she was 71 doing networking and things like that. So I think challenging students' ideas about aging is important. And at FGCU, we have a Center for Positive Aging headed up by Dr. Tom Felke, who's a social worker, and he's its executive director. And so our university is really investing in a notion of positive aging. Getting older doesn't have to just be about losses, the things you've lost in your life that you can't do anymore. There's a great freedom in being older and hopefully a little wiser.
Right.
And being able to contribute to the next generation and knowing that you've got something of value to contribute. So I think it's kind of changing those paradigms and those pre-fixed notions that we have of aging. We actually have a GERT suit, which is a geriatric suit that you can put on, and it has different goggles to simulate eye conditions. It's got spiky things in the back so people can understand what it's like to have back pain. It's got these weird shoes and weird gloves. And you can challenge a student to walk around and go get coffee over at Starbucks using that to see what it's like to try to fish for change in your wallet or your purse and how people receive you, when you're different. There have been lots of social experiments that have been done with people simulating what it's like to be an older person. But I think we need to delve a little deeper and talk more to older adults. They're not scary, just because they're wrinkly and they look a little different. They have so many interesting life experiences. In the Netherlands, they actually have college students who dorm in a nursing home, and they get free room and board for doing certain tasks within the long-term care setting, which is a fabulous model. Why aren't we doing that here in the U.S.?
Yep.
So that kind of stuff where we are creative in our thinking of aging, think of the energy that those college students bring, but then the wisdom of those older adults who, when they're drowning in their schoolwork, they can say, you got this, it's going to be okay. I thought I couldn't do this in life, and I was an executive doing this, or I was a teacher or something else. So each generation gives back to the other, and it just creates value for those older adults. And I think we really need to do that, change our thinking.
So I guess maybe a follow-up to that idea, I guess we're talking to a lot of hospitals and health systems about a hospital at home. Are you guys kind of thinking about that with your nursing curriculum and how that might improve, say, care for geriatrics?
Our local hospital system just started a hospital at home program. So it's relatively new to this area. I came from a model in Pennsylvania where they did a lot of home care. And so IVs were done at home. They actually used paramedics in the community to go out and to do home visits, which was interesting, to do some assessments. And then nurses were heading up teams at home. They actually had practices for 65 and older, where I came from, that dealt with like healthy eating, yoga, stress reduction, and they had a lot of geriatricians and social workers and different folks in that model. So I think, yeah, you're right. We need to keep up with that in our nursing education to expose students to medical home, where there's one-stop shopping for all of your healthcare needs if you can, as opposed to sending us out to a bunch of different specialists with fragmented care. And I think we're going to have to find efficiencies in the U.S. healthcare system. Now we've had a change in presidents, a change in governance, and we'll see what happens moving forward for healthcare. But we've got a lot of people and, scarce dollars. And sadly, despite the fact that the U.S. is one of the most expensive healthcare systems in the world, what is it, Greg, 37th that we rank, I think, in terms of outcomes? I can't imagine the current administration is going to let that go by without trying to tackle it. I hope not. I hope everybody digs in and says, hey, we've got to do better than this. So my hope is that these creative models, we can gather data and look at the outcomes. And if they are saving money and improving access and improving satisfaction, let's think out of the box.
Yeah. So I guess some of these themes, one of my last question would be about the integration of technology, say in a simulation environment versus like in a real hospital care setting. So I guess what we find is that the health systems end up with a lot of bureaucracy and a lot of rule following and a lot of reasons why they can't do things. So we're in your simulation environment. Are you trying to educate your team with some of that resilience to deal with all that kind of stuff? Because I think that's a challenge. And then I guess also in a simulated environment, you can create some of those disruptions and distractions. But I think we find sometimes the sim lab is much better equipped technology-wise than the actual hospital down the street, because they haven't, for whatever reason, haven't been able to do all the things they want to do. So how do you maybe help set expectations with your students as to how to deal with all that once they get into the workforce?
Sure. So actually, I will say our two largest hospital systems that we partner with have sim labs, and they're pretty cutting edge. And I will say through some grants that we've had in collaboration, they're called line grants, learning and nursing education. It helps you have to have a clinical partner. They give you so much money and our board of governors matches it. And again, that was Governor DeSantis really supporting nursing, and also through the pipeline funding that we got to increase recruitment and retention of nurses. But I think we kind of sell our hospital partners a little short, to be honest with you. I think that there are some very creative problem-solving things that are happening in our local hospital systems. I work with the two chief nursing officers of our major health systems, and we've been very engaged as partners, and they have a good shared governance model. They're really trying very hard to find solutions with their staff. And I think there's a lot for us to learn from that. So as far as simulation, we simulate a lot of things. And in fact, the equipment that we use, again, our clinical partners through these grants were able to give us some of these monies through our matching funds, and we've been able to update our stuff. But we typically buy equipment that they use in our local hospital because we want our students to be very acclimated to the equipment so that it's like a walk in the park when they go to use that IV machine, because the pump is something they use every day. The same thing with our anesthesia, program. We have anesthesia machines that are like each of the places that we send our students, so that they've had exposure to the different types of anesthesia machines and they're familiar with it. And yeah, it's hard to create every disaster or problem that they'll encounter, but we can do quite a bit. And the other thing we try to do in our courses is something called a root cause analysis. So they take a clinical problem and they try to analyze it and find out what was the root cause of that problem. Was it a sentinel event that occurred? How do they deal with that? And those are assignments the students do for quality improvement, because we have an evidence-based practice course and they learn about quality improvement. And so they can pick a problem the hospital's having, and that's our give back to the hospital. It makes it a win-win. We try to practice problems the hospital needs help with, and maybe that could be a student project, so that we're trying to give back. We're trying to coordinate better so we can do more of those kinds of things for them.
Well, that's excellent. I'm so glad to hear that you're cooperating, or that you're partnering with your hospitals and you have a feedback loop, or you guys kind of work together. Because I'm assuming a lot of your students get placed in the region, right?
Yes.
They're not, yeah, that's awesome. Well, thank you so much. So, Greg, I'll turn it back over to you.
All right, great. Thank you, Keith. So, Brenda, I want to thank you for taking the time today, sharing your insights, your time, your perspectives. It's always a pleasure. And also to our sponsors, Storage Systems and Simplified Medical, who made this conversation possible. Just as a final thought, do you have any final advice for nursing educators on how they can better prepare nursing students for the challenges ahead?
I think it's important for us to keep our enthusiasm high and remember why we're doing what we're doing. Sometimes it can feel like a thankless task, when we experience some discouragement, as teachers. But I think that we just need to remember that we're preparing that workforce of the future, and these are the individuals that are going to be taking care of us and our loved ones. And we want to be sure that we're doing the best job possible. And I have to say, I work with some very fine, very motivated nurse educators. And I think it's about taking a lot of pride in what we do and just staying up to date on the latest developments that are there. And there's a lot of opportunities available for us. So it's a sacred trust. We see it as that because we know that we're making a difference in the next generation of patients. And we often get care from our graduates. So we are very vested in making sure that they're well prepared. But thank you so much for the opportunity to speak with you. It's been a pleasure.
Great. All right. Thank you, Brenda. Keith, do you have any final thoughts on today's webinar?
Well, I thank you very much, Brenda, for taking the time, but also thank you for the work you're doing. This is really important work. I'm really encouraged by your enthusiasm and the kind of approach you guys are taking. So congratulations, and hope you'll come back maybe in the future. We can keep talking.
Love to. Thanks so much, gentlemen. Have a great evening.
Thank you.
Brenda. Bye. Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.